Looking forward to this discussion. I'm Kelley Keenan. I'm the founder and Boston area instructor for Hypnobabies Boston. Hypnobabies is a 6-week childbirth education course that teaches not only pregnancy and birth basics, but also self-hypnosis techniques to allow women to have a comfortable and more easy birth experience. I'm also a former Hypnobabies student, so I know the program from both sides.
Can you elaborate on what is self-hypnosis?
Sure. When we talk about hypnosis, I think the first thing to know is that all hypnosis is self-hypnosis, meaning no one can force you into hypnosis. No one can make you do anything you don't want to do. So the only thing that you need to do is be willing to accept suggestion. So we've all seen those stage shows where hypnotist is on stage, brings people up from the audience and makes them do, or what we think is going on is he's making them do a bunch of crazy things. But in fact, they're just accepting suggestions. And so we're taking that same sort of method and just applying it to childbirth.
Okay. So one of the questions that I received a lot as I started marketing for this webinar was, what is the difference between hypnobabies and hypnobirthing?
Sure. There are many brands of hypnobirthing out there, but I do think that Hypnobabies has some unique benefits. One of those is that we teach medical grade childbirth hypnosis. So this is the same type of hypnosis a person might use if they are having oral surgery, but they can't tolerate an anesthetic. They would learn something that we call hypnoanesthesia. And again, taking those same methods and applying them to childbirth. So that is something that's unique to Hypnobabies. We're not teaching you relaxation. We're teaching you medical grade childbirth hypnosis, which then gives you the effect of relaxation. The second thing is that we teach eyes open childbirth hypnosis. Some of the hypnobirthing programs say that you need to be lying completely still, not moving, for you to remain in a state of hypnosis. We know that for effective birthing, you need to be changing positions every 20 minutes, getting up, moving around as much as possible. So we do have various levels of hypnosis that we teach our students to allow them to walk, talk, move around, communicate with their providers while still remaining in a deep state of hypnosis. And I'd say the third advantage is that we're a fully comprehensive program. There's no need to go to any other class or study any other type of program. With Hypnobabies, you're getting everything that you need to know about the pregnancy piece, the birth piece, and some postpartum as well.
So I know, and you can correct me if I'm wrong in any way, but do you find that a lot of times when you introduce the idea of Hypnobabies to people that they have that stigma of you're going to wave something in front of them to hypnotize them, and they kind of don't really know or understand what it is because that's the only association they've had? So how do you handle approaching that conversation of this is what it is, this is what it's not, and this is the philosophy behind what we do?
That's a great question. Hypnosis definitely sounds weird to a lot of people. And we do hear that a lot. You know, what are you going to be doing to me? Or, you know, what exactly is this? I think it's important to know that hypnosis is a state that we are all in and experience every day. So when you're driving down the road, for example, and you miss a turn because in your mind you're rehashing a difficult conversation you had earlier that day, that would be an example of you being in a state of hypnosis.
Happens all the time.
Right? If you're on a phone and you're watching a video, you're in a crowded Starbucks, for example, and you're able to tune out all of that noise around you to really focus on what you're watching on the screen, that's an example of being in hypnosis. So it's a very natural state of being. What's really going on is that we have our conscious mind, which is allowing us to have this conversation right now, and we have our subconscious mind. And right in between those two things is something called the critical faculty. And with hypnosis, you, and specifically for birth, you're trying to retrain your subconscious. The critical faculty will either accept suggestions coming in from the outside or bounces them off. It acts as a filter of sorts. So with hypnosis, you're trying to bypass that critical faculty to get in and reprogram, if you will, the subconscious with positive impressions, feelings, and images around childbirth, which are sorely lacking if you are an American woman.
Yeah. So a lot of women, at least from my understanding and who I know, they have this idea that pregnancy is, it's going to be scary, and it's, the birth process is going to be painful, and they're frightened and they're looking for resources and they're looking for help. How would you say Hypnobabies works upon, like, what are the changes it can provide, or what is the different benefits it can provide in helping women who are afraid of pain of childbirth?
Sure, that is probably the number one thing that brings people to the program. And as a mom myself, I can relate to that. When I was looking for a childbirth program, I thought that there are a few things that are important to me. One is that I want a natural childbirth, but I also didn't want to be dreading that childbirth experience. I thought that's a terrible way to start out, to be, dreading that day when I'm meeting this new family member and this person, this life I created. So when I started doing my research, learned about Hypnobabies, I thought, well, I've got to take a childbirth ed. This does sound crazy, but hey, I'll give it a go. And had these two really beautiful births using Hypnobabies. The one was in a hospital, and when I had my son, when labor started at 38 weeks, all of a sudden, I knew that was a little early, but I wasn't afraid at all because I knew exactly what to do. I had practiced all of these techniques for the entire final trimester of my pregnancy. And so I just did what I had been practicing and had this excellent experience. Almost 4 years later, I had a home birth with my daughter, which was hands down the best day of my life. I remember this time during that labor where I was sitting on my birth ball and using my hypnosis techniques and thinking of the words, I know why people use drugs for this experience, but not feeling that in my body, if that makes sense at all. I was feeling pressure, I was feeling tightening, but any sort of discomfort I felt seemed very far away. And that, for me, I would say that my births were, fairly painless processes. Although that said, I should say that Hypnobabies is not promising painless childbirth, but what it is promising is the best childbirth experience for you as an individual based on your individual circumstances.
I love that. I mean, as chiropractors, one of the things we do is encourage our moms to change their perspective a little bit about the birth process and understand that it doesn't have to be painful. It doesn't have to be scary. It's supposed to be beautiful. It's supposed to be a connection. And, we believe it's important to have a birth plan, but to also understand that things might not always go in that direction. But it is really nice to hear your perspective and your experience on how, your mindset played a huge role. Because we're looking at pelvic alignment, we're looking at your posture, we're looking at everything that's going on for mom and baby physically, but a lot of it is mom's mindset, and the experience she has is going to go through the thoughts that she's having and how that's attracting certain realities.
Right. And I think it is important, Dr. Nicole, to remember that there are things you can do during your pregnancy to have a better birth experience. And Hypnobabies fully supports chiropractic care during pregnancy and knows how vital that is, that your baby's position has a lot to do with how you give birth, and that chiropractic care is all a part of that. So it's very important.
Yeah, I mean, there's definitely so many different avenues, and I'm sure during your program you touch upon exercises or things that they can do at home to help them. And that's the same thing we do in our office, is we try to encourage things that they can do outside while they're home with their partner.
Absolutely. Mm-hmm.
One of the things that I had saw when going through your website was how to have you talk about having a more involved or more confident partner. Can you touch upon that a little bit?
Sure. Hypnobabies gives so many opportunities for the birth partner to be as hands-on as he or she wants to be. So we know that sometimes partners are reluctant. In fact, what I hear the most when women sign up for the program is that their husband is skeptical. They just don't know what it's all about. There's the whole hypnosis piece, sounds weird. But once they start coming to the class, we in fact dedicate the entire first class to discussing what hypnosis is, what it is not, and talking a lot about mindset. And that is very welcoming, I think, for a lot of the partners to really start to involve them in the process. They have scripts that they can read to the pregnant mom throughout the week as part of the homework, and are understanding the program in that way, knowing certain physical cues that they can use with moms to help the mom enter hypnosis. And so they have this entire toolkit, even including an audio track that is dedicated to birth partners that that birth partner can practice with ahead of the birth to help the birth partner gain confidence. So they're not flying blind, and they're able to really act as an advocate for moms, which is especially important in the hospital.
Absolutely. Now, do you encourage that they come to each of the classes, or is it just the first class, and how does that work?
Yeah, good question. Hypnobabies is set up for pregnant moms and their partners to attend together for the 6-week series.
Okay. So normally you do your classes in person, correct? They're live classes that you have.
That's right.
How are you transitioning, and what are you working on now with, everything that's happening in our world today?
Right. This is an unexpected change and detour for Hypnobabies, because we really pride ourselves on providing a high quality in-person experience. But with everything that's going on, we are going online, we're going virtual. So as I look forward to my first virtual class taking place starting on May 1st, I don't anticipate anything having to be cut from the program or altered significantly in any way. I think, as usual, the first 3 classes will really be focused on the education piece. As I said, we talk about mindfulness, what is hypnosis, learning the framework. We talk a good deal about nutrition, exercise, baby positioning, and why it's so vital to pay attention to those things. We talk about your choices in childbirth. A lot of my students come to me and say, I had no idea that I could say no. And I'm going, yes, this is your body, it's your baby. You are the consumer, it is your experience. So that's a particularly rewarding class for me. And then the final 3 classes are putting into practice the things that couples have learned. When do you know when it's time to go to your place of birth? Birth partners, how can you support your partner at various stages along the way? And finally, we conclude with a birth rehearsal, which again, even virtually, I anticipate that this will go really well with couples practicing in their own homes with a little bit of coaching through Zoom. So that's the course outline. And again, with the move to virtual, I don't anticipate any large changes.
Can you touch upon a little bit, what is a birth rehearsal?
A birth rehearsal, we basically have you birth your baby in about 10 contractions or pressure waves. So it's a very quick process. But the idea is that, as much as we can approximate a true birth, we try to. I give some verbal prompts to sort of explain what's going on, what mom might be feeling, and what that partner can do, either verbally or hands-on, to help support the birthing mom in that moment. So the birth rehearsal concludes with dolls being held up and celebrated and welcomed into the world.
Oh, that's awesome. I love that.
It's a lot of fun.
Yeah, and I think it's good for them to have that idea of what it could be like, even though it might not be to a T what the rehearsal was, but at least they have some type of perspective and expectation rather than going into it a little bit blind.
Right. And we know that laboring women have certain signposts, right? During the early stages, they're more verbal, they're still chatty, which kind of gives you an idea of where they are. Later on in the process is that, getting to 8, 9, 10 centimeters typically they are not communicating at all with you, right? They're in the zone. And so it's important for birth partners to understand that, to learn it, and to know how to support in those moments.
That's awesome. I want to throw a little curveball at you, if that's okay. But right now, with everything going on, I know that there's a lot more moms opting for home birth. If you're okay with it, do you want to touch upon a little bit of what your experience with that was like?
Absolutely. In fact, I'm a very vanilla, mainstream type of person who never thought that I would have a home birth, but was introduced to home birth in sort of similar circumstances. In Southern California, there was one hospital and one midwifery group who had privileges at that hospital. And when I was about 6 months pregnant, that hospital closed their maternity floor. So all of a sudden, my midwifery group was left with nowhere to go. And there were no midwives practicing in the county at that time. This was in 2008. So I had a choice to make. I could either switch my care to an OB group, or my certified nurse midwife, of course, they typically practice in the hospital, but she said, if you'd like to consider a home birth, we'd be happy to do that for you. And, I thought, no, that's not for me. I went on to watch Ricky Lake's The Business of Being Born documentary. I read Pushed by Jennifer Block and consulted a variety of other resources and said, what, I think this, at least for me, I feel safer at home than I do transferring my care to an obstetrician. So I started making a plan and putting that together, and knowing now what I know, I would have done both of my births that way at home, because there is, I use the cat under the shed example, Nicole, with a lot of my students. If you look at mammals giving birth, they're not just out in the open with a bunch of people, a lot of beeping machines, bright lights, lots of noise. That is not how the cat is going to give birth, right? The cat is finding the nice, cool, quiet shed, going underneath, and that's the ideal scenario for birth. And that is when your body can really relax, let go, open up, and sort of get out of the way and just let the process take place. So home birth is similar to that. Where are you more comfortable than when you're at home? And a situation that often occurs is you'll be laboring at home. It's time to switch to the hospital or the birth center. And when you get to that new environment, your body kind of seizes up and says, this doesn't feel safe to me anymore. And the pressure waves slow down a little bit. And then they're augmented maybe with some Pitocin or something else. And so that sort of starts this cycle, right? The great thing about home birth is that you're able to avoid all of that in most cases by just being in a familiar, comfortable environment, your own home.
I'm really glad you touched upon that, because that is one of the big things that I've talked to with friends before, once they find out they're pregnant and they're creating their birth plans, is you need to be where you're comfortable. And people are so different. I have a friend who definitely, being in a hospital setting is where she feels the most comfortable. She feels safe. She feels relaxed. And for her, she needs to honor that, because a home birth might not be, that might put her into that stressed out state, that very, fight or flight sympathetic mode where she doesn't want to be when she's giving birth. Where on the other hand, other women will be the opposite, where they're more relaxed at home, or maybe they're relaxed at their parents' house where they grew up and that they want to have the home birth, or in a birth center that's like a medium between the home birth and the hospital setting. And I think that's such a beautiful thing to know and to realize, is it's important to be where you feel safe. And earlier you had mentioned how some moms are like, oh my gosh, I didn't know I could say no. That's another thing that I love that you touch upon, is making sure these moms know that they're empowered. This is their birth experience. This is their, it's their right. It's their ability to pick and choose what they want, and to question things, and to not have to just follow in the footsteps of what one authority might tell them to do, whether that's, their birth coach or the nurse at the hospital or their midwife or doula. Like, they have the opportunity to make their own decisions. And I think a little bit of that has gotten lost along the way. But I see a huge movement coming back to re-empower women in their birth process, which is beautiful.
Right. Yep. I agree. It is shocking to me sometimes, though, that people think, well, there's this one way to do it. It's this very medicalized process that we have set up where you go in and someone sort of tells you what to do and does the work for you, and it just seems so disempowering to me. If that's the experience you want, that's fine. But a lot of women don't, and they're caught off guard. I think they think that they're going to go to the hospital and a nurse is going to be there rubbing their back. That's not the reality. The nurses are busy, right? Mm-hmm. And you need to go in with your own set of tools that you are going to use, that your partner can use, maybe a doula is going to use to help you create the experience you want, because it's not just sitting there waiting for you. You're going to need to do something to help create that.
Have you ever had a mom who maybe the partner couldn't make it to the classes? So has someone ever brought a doula with them, or another, someone on their birth team, maybe their mom or their sister in place of their partner? How has that worked with you?
Sure. Yes. This program is definitely for single moms or for those whose partners can't make it for whatever reason. I had a lovely best friend pair who came, and the non-pregnant friend purchased the Hypnobabies childbirth classes for her best friend when she became pregnant, because she had had a traumatic first birth with an unexpected C-section, and was just deathly afraid the second time around. And so her best friend, wanted to support her, purchased these classes for her, and also served as her partner for the class. So they attended all classes together, and she went on to say that she had a very empowering experience the second time around with the information that she learned from Hypnobabies.
I love that. I think that's awesome.
It was wonderful.
Yeah, what a sweet gift. And
yes.
So I want to ask you a little bit, I know we touched upon one of them, what are some of the common reasons that people will, like a mom will reach out to you or someone will sign up for your course? Do you know what some of their concerns or thoughts are before they get involved?
Sure. We have a lot of people looking to Hypnobabies because they want a natural childbirth. They've done a lot of research, and many of them have discovered what I was just explaining, that really the hospital is set up to, have you come in and they'll give you some medication and, things will go from there. But a lot of women don't want that, and they're looking for a way to take control over the experience. So we do get a lot of moms looking for that. That said, Hypnobabies is not strictly for only those who want a natural childbirth. There are a lot of people who come to me on the fence, and they say, I don't really know what I want, but I want to at least have some options and some ways to sort of manage this experience. So a lot of people are looking for that as well.
Awesome. So we have a question from a guest. It says, I'm currently 9.5 weeks pregnant, and I'm wondering when would be the best time to start a program such as Hypnobabies. This will be my second child, and I definitely want to feel more in control and calm this time around.
Great question. So with Hypnobabies, we recommend that you start between 26 and 32 weeks. So sometime at the start of that final trimester. This gives you enough time to complete the 6-week course, and then also a few weeks left for maintenance is what we call it, where we're introducing some additional tracks, audio tracks to listen to until your baby is born.
Awesome. And anyone else who has questions, I just want to put the note in, feel free to send them into the chat and we will address all of them as we go along. But that was a great question.
Dr. Nicole, I wanted to point out too that while we love directing women to the in-person classes, we know that sometimes it's inconvenient to get there. So there is a home study Hypnobabies course as well online. So if you live too far away from my in-person classes, for example, that is an option you might want to check out. And there's more information on my website about that.
Is that similar to the online course you're going to be doing, or is that something separate?
Yeah, it's really not similar. It's really is truly a home study program where you work at your own pace, and there are totally different set of materials for that. So that, of course, the advantage of the in-person is that you have set times, dedicated times where you're meeting with the group, meeting with me, and getting customized, personalized instruction. So that's, again, why we suggest the in-person class.
We have another question. So is Hypnobabies okay for someone who has been told they are high risk?
Great question. So yes, if you have been told you're high risk, you are planning a cesarean section just because you want one, whatever the situation may be, Hypnobabies can help you. And in fact, in those situations, they can be so anxiety inducing. So what better way to start the process than to take a Hypnobabies course and spend those 6 weeks learning these hypnosis techniques that they don't just help you in the birth process, they also help you beyond. You know, from personal experience, I shortly after the birth of my second daughter, I experienced a really personal trauma in my life. And I remember thinking, if I can use these hypnosis techniques to push out a baby in my own home and do so in comfort and in ease and to really enjoy the experience, then I think that I can definitely get through this, you know? So it's something that you really carry with you throughout your life. And that's another sort of unexpected benefit of taking the Hypnobabies series.
So she responded to your answer and said, wow, thank you so much. It sounds empowering. And I love that.
Very.
Empowering is it's a word that I feel is gaining a lot more strength and a lot more energy right now. And I love it. And I think that's the best way to define how the birth process in general should be and how pregnancy should be and the whole experience. It should be very empowering. It should just enlighten your strengths and your ability and the opportunities you have. And then how, this is me going on a small chiropractic rant, but how wonderful are our bodies that they can create another human being. And you don't have to think about it. Your body just does it. It knows how to react. It knows what goes where. It knows how to develop the brain, the nervous system, the body, just all of it. And when there's something wrong, your body knows how to adapt to it. And
it's truly remarkable. It's almost like playing God. I remember thinking, you know, I have this divine opportunity, and so, you know, I want to do a good job, and that's another reason why I, you know, took my time in seeking out the right program. I also want to point out, Dr. Nicole, that there are some childbirth programs that assume that pain is inevitable in childbirth, and so they encourage you to make friends with the pain. The pain is your friend, and you're just going to push through the pain, and it'll all be worth it. And I think it's important to know that Hypnobabies is the exact 180 of that. We are striving for pain elimination. We are trying to train you to train yourself to reinterpret those sensations as just pressure or tightening, to really just step back and look at your body and go, all this is just, it's a bag of muscles squeezing and releasing and squeezing and releasing over and over again. You're just kind of riding out these waves, and you have all these tools, all these audio tracks. We leave our students with about 16 different hypnosis audio tracks by the end of the series. And a lot of other, you know, hypnobirthing programs are kind of sending you with one track and a book and saying, you know, good luck. And but, you know, Hypnobabies students should really feel supported all the way through and know that the philosophy of pain elimination is really what we're all about, and that it just does not have to be this excruciatingly painful experience.
I'm going to touch upon that a little bit with chiropractic, because that isn't one thing that we strive for. And I think that's where our two, you know, our care and your program can really fall hand in hand, is that, you know, we can't promise and guarantee that your pregnancy or your birth process will be pain-free. However, the way that your pelvis is aligned, the way that your body has any strain or tension is going to play a huge role on the kind of pain you feel during that process. So if you're being adjusted leading up to your birth, we're releasing that tension. We're making it so that your body can move. Your pelvis is moving the way it needs to. Everything is expanding so that your baby has room to grow and to move around. And it takes away a lot of that stress. And at the same time, it's having an impact on your nervous system to be able to adapt and understand what you're feeling, and to, you know, have the most optimal function, the optimal changes during this process. And I think that's why it's so important to have a team that cares for you during your pregnancy. And so a program like this is absolutely beautiful. Having a chiropractor, having a midwife or a partner who's helping you do exercises at home, whether that partner is, you know, your romantic partner or your friend or a family member or someone that you hire to come in and be there for you, like a doula. It's just, we all work together, and we all have that focus of pain elimination and having an
Right.
enjoyable experience.
Right. It really is important to assemble a team, because, as you said, there are, you know, just in today's Western society, what are we doing? We're sitting in cars, we're sitting down all day, and that causes all of those pelvic ligaments to get really tight. And sometimes that can be the one thing that is standing in the way of your baby exiting smoothly, right? Is what you're talking about with chiropractic, that, you know, something is just in the way and needs to be moved, adjusted, loosened. And so starting early is better.
Yes, absolutely. So we have another question. She said, I'm very interested in having a community while pregnant. Do you find that the women in your classes form friendships? What about the partners?
Great question. All of you come to class and you're in the same boat, right? Most time, everyone is a first timer, although I'd say every class has maybe one couple who had a previous experience, and usually a more negative birth experience, to be honest, and they're looking for something different. And we have some great camaraderie that happens in those classes where people do share tips, resources, they want to stay in touch. We get a text group going and all the cute baby pictures start to come out at a certain point, everyone's sharing. So there really is that nice community aspect that Hypnobabies encourages.
I love that. I think it's important that you do that, especially I like how you said you have text message groups and you're cultivating that community and that culture where everyone can be close and lean on each other. And, you know, one person's experience is different from the next, but to have that and to have, there's definitely a different level of relationship between this is a person who's a care provider for me, but then this is a person who's experiencing it with me.
Right,
So it's
right.
beautiful to have that connection. So that was
Yes, both are
a
important.
great question.
Yeah, yeah.
Awesome. So let's talk a little bit. Where are you located? How can you be contacted? How can potential clients get a hold of you?
Sure. I would say the best place to learn more is hypnobabiesboston.com. I also have an Instagram account, Hypnobabies Boston, and a Facebook page, Hypnobabies Boston.
I'm going to share my screen real quick to put up the
Yeah,
contact information. We have a viewer who has
great.
to hop off for a call, so I want to make sure she can get this first.
Oh, great. Okay, very good. Right, so this has all of the essentials, ways to reach me and to learn more. Hypnobabies also on Facebook has something called the Hypnobabies Support Group, where prospective students or current students can go on, ask questions. It's actually staffed every day by the founder of Hypnobabies, Carrie Tushoff, who will answer any questions you have promptly, and she's very involved in the community. So there are a lot of resources for interested moms.
So I'm going to, for anyone who attended the webinar, I'm actually going to email you this page as well. So if you're not able to write it down or hold on to it, I will send it out to you. Just to touch upon a little bit, so all of Kelley's information is here, all of the Hypnobabies Boston information, so you can reach out to her there, check everything out. In the bottom corner, you'll see my personal email is there. Anyone is welcome to contact me, any information, and I'm happy to connect you with resources, providers, with Kelley, with anybody I can assist you with. On the other side, you'll see Slak Chiropractic. So Slak Chiropractic is the office in Burlington where I work. They are fantastic. The practice is owned by husband and wife, Dr. Jean-Marc Slak and Dr. Linda Slak. They've been in practice for over 35 years. All three of our doctors are Webster certified. If you are not in our area, if you're not in Burlington, Mass., feel free to still call them. They are open right now, but still call the office and we can always connect you with a provider who's closer to your home. The other option is if you are not in Boston or you're not in the state of Massachusetts or you just want to find your own provider, icpa4kids.org is a place where you can go and find a Webster certified practitioner. But so now that everyone has this, and I will send it to you, I'm going to close out and just see if we have any other questions. It doesn't look like we have any from attendees. Kelley, is there anything we haven't touched upon yet that you really want to make sure that our attendees have this information, or what are some of the takeaways you would like for them to have from this webinar?
The main takeaway I would love to leave is, if you want a birth that is not your typical American hospital birth, again, meaning that you go in for brief visits with an obstetrician, you show up on the day of, you get medication or of some kind as soon as possible, and sort of let others do the work for you. If you're looking for something other than that, you need to prepare and you need to start early. And that includes a comprehensive childbirth education class like Hypnobabies. That includes chiropractic care. That includes looking at other resources such as spinning babies to learn more and to really get educated, because that is going to be the key to achieving the birth that you want.
Awesome. I love that. And I think I speak for both of us when I say that you can look at us and know that we're on your team. So even if you don't hop into the Hypnobabies program, or you don't come see me in my office, or even want either service, we are still someone you can talk to, still someone you can ask questions, ask for connections.
Absolutely.
That we're your extended team no matter what. But
That's
I
right.
want to thank everyone for being on the call. Kelley, it was so awesome doing this with you, and I had been looking forward to it for so long, and I'm so glad. But I'm going to go ahead and end the meeting, but I look forward.
It's been wonderful to have this chat today. Thank you, Nicole, for arranging it.
You're welcome. Enjoy your weekend, everybody.
Thanks, everyone.
Bye.